أنهم يخسرون حياتهم بسبب القتال واسع النطاق.
Today we're releasing the report from Médecins Sans Frontières, A War on People, the human cost of conflict and violence in Sudan. The report shares our findings and our serious concerns on the absolute collapse in the protection of civilians in Sudan by both warring parties. The warring parties in Sudan have been inflicting horrendous levels of violence on people since the war started in April of last year. The report sheds light on the direct and deadly impact of the war on the people of Sudan, which has left the country's health service largely in ruins.
Uniform. When I turned to walk back into my house,
Over the past 2 months, health facilities that we support have been repeatedly attacked and targeted. We were forced to suspend operations in Wad Madani in southeastern Sudan, and most recently in the Turkish hospital in Khartoum. Since May, MSF-supported hospitals or premises have been hit by shelling or airstrikes at least 5 times in Omdurman, Khartoum, and El Fasher, leading to the deaths of health workers and patients, including children. Hospitals in which we work in El Fasher and in Khartoum were also stormed and attacked.
I was stabbed many times and fell to the ground. The soldiers broke.
In conflict areas in Khartoum and across Darfur, we support some of the few remaining hospitals and emergency wards functioning in Sudan. Our teams treat thousands of war-wounded patients in locations surrounded by violence, large-scale bombing, and shelling. In these areas, homes, health facilities, and essential infrastructure have been hit, destroyed, and made inoperable. In the camps and gathering sites where refugees from the region and displaced people seek safety, patients recount horrific stories of inhumane treatment and violence perpetrated by armed groups. People's accounts describe forced evictions, looting and arson, degrading interrogation, arbitrary arrest, abduction, and torture on a systematic level. Sexual and gender-based violence is pervasive, but critically underreported due to the stigma, silence for fear of retaliation, and the void of services and confidential spaces.
Inside the compound was in pieces with no tires and would be
Ethnic violence and sexual and gender-based violence must never happen. MSF calls on warring parties to stop all targeted forms of violence and abuse against the people of Sudan.
Barely conscious. I could hear them say, "He will die."
Today, we call on all warring parties to ensure the protection of civilians and humanitarian workers. We call on vested partner states and regional bodies to increase pressure on the warring parties in Sudan to abide by their obligations. We call on the warring parties to facilitate and enable the provision of humanitarian aid. We call on international aid organizations and donor governments to ensure that aid is delivered to people in need and to urgently increase the humanitarian response. The scale of humanitarian aid response in Sudan is nowhere equivalent to the need. We need the UN and the humanitarian sector at large to scale up in order to provide a more adequate response in terms of the huge health needs that we see, the massive needs in relation to nutrition, shelter, water and sanitation. I mean, this is the most significant humanitarian crisis in the world that we face today. Perpetration of sexual and gender-based violence continues in Sudan today. So in South Darfur, we started sexual violence services in late March. Since then, we have had a fairly constant stream of survivors accessing those services. 80% of those survivors are under the age of 18, 20% of them are under the age of 10.